This brief presentation is to describe patient self-management in multiple chronic conditions being 2 or more chronic diseases at any given time from a health policy perspective. Hi, I'm Dr. Kim Keebler. I'm the founder and director of the Multiple Chronic Conditions Resource Center, which is a resource for all healthcare professionals, the patient and caregivers, and policy makers. I'm also a 38-year clinician, a published researcher, an educator, and a health policy expert. The Patient Protection and Affordable Care Act that was released in 2010, not only did it have a lot of other initiatives that were involved in this huge legislative package, but there was a huge push to begin to look at the concept of multiple chronic conditions and the aspects of patients taking a more active role in their care. The Affordable Care Act wanted to investigate, address, enhance the prevention and clinical management of chronic diseases, and to improve the health status of Americans living with multiple chronic conditions, which is the largest, fastest growing, and costliest patient population in the United States. The U.S. Department of Health and Human Services, with other agencies such as the Centers for Disease Control and Prevention, released a strategic framework that provided the direction for multiple chronic condition initiatives in the United States. This framework identified 4 primary goals. The second goal you can see is self-management, which we're focusing on here, but to just bring attention to the fact that the whole initiative on multiple chronic conditions is to improve the healthcare and public health system changes to address this patient population, to provide better tools and information to healthcare workers, public health providers, and social service workers to deliver care to people with multiple chronic conditions, and to facilitate research to fill knowledge gaps about the interventions and systems that can benefit this patient population. Particularly today, when we're looking at COVID-19, this patient population is the largest at risk because of their multiple conditions and their debilitated immune system. Patient self-management is defined as a person's ability to detect and manage the symptoms, treatment, physical and psychological, social or psychosocial, psychological consequences, and lifestyle changes that are important to living with a good quality of life despite having a chronic disease. Governments in many developed countries, they manage their escalating costs of chronic disease in the aging population by shifting care responsibilities to patients and family, by taking a more empowered approach to ensuring that their care is appropriately managed. Empowering patients suggests that a patient makes his or her own care choices from available options. These options are also done in collaboration with your healthcare provider or healthcare team through shared decision making. Optimal health outcomes or goals of care occur with a collaborative relationship between the healthcare provider, healthcare team, and the patient and family. We do know that patients who are informed and motivated and involved as partners in their own care do better. Patient or person self-management can reduce risk factors of specific diseases, provides better adherence or making sure that you adhere to your medication schedule, increase physical activity, and by doing this, it actually reduces hospital admission rates. For additional information on patient self-management, Multiple Chronic Conditions Resource Center is available and provides resources for both healthcare professionals and the patient and caregiver.